What's up, everybody? Welcome to RT Clinic. Today's video is for those new clinicians or patients' families or patients themselves. It's going to be real basic in a lot of ways, but I'm going to try to explain some things that are going on inside of a hospital room so that you have an idea so you can advocate for the care of yourself or your family member. Ready? Let's go. We've all sat in a hospital room with a family member and you look around at all the different things around you, and inquisitive minds want to know what they are. And I think it's really important to be an active participant in your healthcare, that you know what's going on in the room. And I don't have to get really deep with these, but I'd like to explain some of the things that you're going to see inside the rooms. First of all, we're going to go to, as I'm going to show, a vital signs machine. So this is a vital signs machine. This is a Welch Allen, something very common that you're going to see in a lot of hospitals. It's on a little rolly cart. It usually plugs in. It does blood pressure. It does heart rate. We can measure temperature, and we do pulse oximetry. So blood pressure is pretty easy. The cuff goes inside on here. Usually each patient gets their own cuff. They're disposable. It goes in this right here, and they can check blood pressure with it. This side is the pulse oximeter. And you're going to see a long line here, and on the end there's going to be a clip. Now, on almost all cases, this clip is reusable. So one of the things you want to look for, and just to be honest about your care, you want to make sure that somebody's cleaning this between patients, because the only way for a pulse oximeter to work is for it to be in direct contact with the skin. So if the pulse oximeter is being used from patient to patient to patient, where a lot of these vital signs machines are when they're being moved from room to room to room, this is going directly on the person next door skin, the person next door skin, and the person next door skin. So one of the things you want to look for with your clinician when they come in, that they're cleaning these things. So before they place them on you, and letting it dry, and that will kill the bacteria. We've got some great cleaning agents in the hospital, and you're able to clean everything with that. Also the cord, like to see them wipe down the cord also, because that sometimes lays over people, and you don't really know how sick the person next to you was. It's really important to make sure that you stay as healthy as you can while you're in the hospital. Another one is the thermometer. So thermometer is interesting. So this actually is an oral one. Yeah, we're not doing rectal in this case, but this is an oral thermometer. It goes inside these little pieces. These are covers, goes under the tongue, gives us a temperature. So we can get some really good vital signs from that. Blood pressure, temperature, heart rate, pulse oximetry. Those are the big ones that we're always looking at for the hospital patients. But as you can imagine, if this is going under the tongue, this is also very, very close to somebody's mouth, even though it does have a cover on it. So another thing I really like to see is the clinicians is cleaning these things when they come in the room. Something you want to look for, and feel free to ask them. You don't have to ask them in an accusatory way, but you can ask them in many different ways, like, what do you use to clean this? Or what kind of bacteria do your cleaners kill on these type of devices? Always be inquisitive. There's nothing wrong with that at all, because you actually could make the clinician or the PCT, the nurse, whoever it is, the respiratory therapist, better in their job by just asking those simple questions. These are the same questions that us as medical providers, if we were sitting in the hospital watching this happen, we would be watching to see where things are cleaned, how they come in, how they're used. Maybe they clean when they walk out, so they clean between patients. So that's another nice thing to ask. Vital signs machine, this is a popular one. There's a lot of different types. Sometimes you have the vital signs machine that stays in the room with the patient, which is really nice. Thermometer is something that, if it's part of this, you want to make sure it's getting clean. The pulse oximeter, because that's going from finger to finger to finger. They're almost always wiped down, but it's always a nice thing to kind of ask just to make sure that's happening so you can advocate for your own care. Now let's look up here above the head of the bed. There's usually a bar up here. There's usually some kind of light. You can't really see it in the shot in this, but there's a light up there. But I'm going to talk about what all this stuff is and what it's used for. So you see these are obviously just AC plugins. That's pretty simple, right? You see gray and red. If you see red on these, actually hooked up to emergency power. So if a hospital would lose power, it goes immediately to a generator, and hospitals are tested on this all the time. So if they lose power, immediately flips to a generator. Usually there's only a very minuscule lapse in time. Nice thing to know is if there's any ventilatory devices, they should always be plugged into red. Like IV pumps, not a big deal in this case because there's an IV pump plugged into gray. But that's the difference between red and gray. So red are the emergency plugs that will run on emergency power. So flip the generator, we're going to conserve power because we're feeding 300 plus beds. So you want to have the things plugged into red so the generator can run those. Going down the way here, you're going to see this next piece right here. It says vacuum on it, and that's exactly what it is. It's a vacuum system. It continuously has a negative pressure inside of it. And what we'll do with this system is we'll use a suction canister if a patient would need this. And I'll show you this, something like this would go in that area. Not all of them are used, and then you can actually add vacuum, and you see when I plug this up, this is actually pulling my finger up to it, and then it's going to pull vacuum back. Now this doesn't pull whatever things or secretions are pulled from the patient. It doesn't pull them back into the wall. It actually goes into a system, which we'll just show in just a second. So that's the suction, the vacuum. The next one says oxygen, and it's specifically for the oxygen flow meter. It's pressurized, 50 PSI of pressure inside of there. I have a cool video on that. I don't know what corner it's going to be in, but one of these corners I'll post it there. So you can watch the video on the oxygen flow meters. You don't have to have them plugged in there, but if they are, that's where we deliver oxygen from, okay? If your family member is supposed to be on oxygen and the flow meter is not attached and it's plugged in over here, which is extremely rare, that shows that they're not actually getting oxygen. And the oxygen level is actually gauged by where the ball is. So if they're supposed to be on 3 and it's on 2, then they're on 2 liters of oxygen. And you look at the center of the ball in that case. These are cool tubes because what actually happens, let's say they're on 5, and let's say there's some tubing and it gets occluded. If the tubing gets occluded, the ball falls. So this ball actually shows you what's getting out to the patient. And you can see in this case, it's getting out to the patient that way. Now we get to these things. A lot of times these will say responder on them, or this is our quick alert system that we have in hospitals. So if we hit these buttons, and don't hit them on accident, but that calls rapid responses or codes into the room. It sends pages to people to tell them to get here quickly if we're having some kind of issue with the patient. But also you're going to see these cords actually plugged in here. These cords actually run to different alerts, like this one right here, which is going to be the handheld patient alert, how they can call their nurse, or they can do those different things. All this goes through this system, and it's the intercom system. So this one's called Responder 5, but hospitals have different ones each time. This is just a simple network port that you can see there, maybe used for some other type of, for some kind of hookup if we have to run something to an EMR. Now we're moving down the way here. You're going to see this oxygen hookup here and vacuum, just similar to what we have over there. And they are identical in case we need 2 oxygen flow meters. And in some cases, some of these rooms used to house 2 beds. So we had to have one for both sides. The nice thing is a lot are single occupancy now, so you have all these extra hookups. You might see one of these that doesn't say oxygen, it says air, and it's yellow. Medical air is actually just air that we breathe, but it has been run through specific testing that it's going to be clean, filtered, and all those different types of sterilized, essentially medical air, because medical air is sometimes used when treating children and whatnot with nebulizers. So you may see a yellow one. This type of flow meter won't fit in there. There'll be a yellow flow meter that will go in it. Nothing to be concerned, but all these things are ready to be used, but until you actually plug something into them, they won't work, and they shouldn't leak. So if you hear leaking coming from these, that needs to actually be fixed by the hospital. The next thing is this is a part of a suction, and you're going to see this vacuum will go right to here, and this will probably look something like this. Remember I was showing before how that suction would turn on and it would pull a vacuum? Well, inside of this actually sits a canister, and inside that canister is where everything is held that comes from the patient, any kind of secretions that are pulled back. So a disposable canister, you can see in this case, it's gone because we throw it all away. But that just goes to show you that it pulls the vacuum, pulls it through this system, but there's a huge filter and nothing actually gets back to any of this other stuff. So the things from the previous patient, the previous patient don't get, and they're not in the room for this current patient. Now, if we look over here, so if we keep moving along over here, you're gonna see this little thing that says Posey Sitter Elite on it. It actually hooks back over to our responder system, and this is going to be a chair alarm. So if the patient's in a chair and they move, they change their weight a certain way, it actually will send an alert back to the responder system and then to the nurse out there so that they know that the patient has moved. Probably an alarm will go off. So it's an alarm system. That's something that you're commonly going to see inside of a hospital. And the last thing I want to show in this video is an IV pump. So it looks pretty self-explanatory. It's got to be plugged in. They do have a battery on them, so they'll run for a while. On an IV pump, just so that you know, there's a little piece here. They put, you hang your IV medications here or fluid. It actually runs down, and there's a little cassette that goes inside of here. And then they program into here what rate they want to give that to the patient. And those are all prescribed rates. Sometimes you'll see two lines coming in where they give maybe an antibiotic and some other, and then some fluid, and they'll have line A and line B, and those are all programmed in through here. So what else is really important? So sometimes these things will alarm, and on the top of them, they'll usually say what the alarm is, and usually it's volume delivered, which means I said this was 100 milliliters, and it delivered it and stopped at that point. So it's really important once that alarm goes off, within 5 to 10 minutes, the nurse really should come in, and I think that's a good opportunity to maybe hit the call light and say that this thing is alarming, because when your IV is just there and there's no fluid going through it, they have a tendency, they can clot off. And this isn't clot off like throwing clots all over your body, but it just, if the IV is no longer patent or open, then they may have to put another one in. So it's really important to have fluid running through them. They can also have saline locks in that do that, but if you've been giving something and this machine shuts off and we don't continue fluids, we should lock it off. But it's important that if this thing is alarming, that there is some response to that. Especially, I mean, I said 5 to 10 minutes, but especially within a half hour for sure. So that's what an IV pump does. If your family member, yourself are very sick, you'll see multiple one of these IV pumps and more bags of medication that are mixed specifically in the pharmacy. Don't ever mess with this at all. Don't hit any buttons on this at all, because you have the ability to change things to be very, very deadly by changing anything on this. So even though you're like, they're not responding to that alarm, don't ever hit anything on this machine, because even as a seasoned clinician myself, I don't go in and mess with anybody else's IV pumps. It's just one of those things we don't do. So because everybody, and you don't know what kind of medications and what kind of dosages, sometimes really small dosages can make huge changes in patients. So these are really particular in the way that they deliver. Now, these are used between patients, so this could be yours, and then the next patient can get the next one. So it's always nice to see that this is cleaned up also, because although nothing that actually comes in contact with this comes in contact with your blood, it is still something that's quite intimate inside of a patient's room, and something you want to make sure is cleaned each time. It can come unplugged also, and will beep also in that case, but like I said, they have a long battery on them. Really nice though, if the power does go out, it's nice to see that these things get plugged into red. In most ICU areas, everything's red. This is a med-surg floor, and so we're not going to have quite as much up here. But we may go into the ICU and look through one of their rooms in the future. There's another thing that you're going to see in some of these rooms, in this device right here. This is actually a Sharps device. It's really self-explanatory. Most people know what these are. But one thing that's really important if you're advocating for your care, your family's care, is that there is a fill line on these. It's really common right here. And if that gets above that fill line, which is 2/3 full, it should be changed. And why should it be changed? Because inserting things into here could actually cause the clinician to get stuck. It could cause anybody who's inserting something to get stuck with a needle, which we don't know where that came from. So if you ever see that these things are above this line, as you can see, there's a line on there. above that fill line, that's something good to reach out to your clinician and say, hey, I think the sharps container is a little bit full. There's nice ways to do it, non-accusatory ways, maybe a nice thing for a PCT to do. Housekeeping usually has a key where they can come in, or environmental services, to be able to do that for the patient. I hope this was kind of a helpful little review, and if you're interested in seeing an ICU room and going through an intensive care room, I could definitely do that. This is not for the seasoned clinician, but more for the new therapist, the new nurse, the new PCT. Maybe you're just starting on the job, a little room orientation, or a patient, a family, or a patient themselves who's looking for, what the heck is that thing in this room, or what's it used for, or why does it look like it's full? I'm here to explain that. So please put comments below. Remember to subscribe. I really appreciate all my subscribers, and they've grown slowly over time, and give me some comments if you want to see something in the future along these lines. I go from super advanced to super simple, but I've kind of want to get back to basics and just start making everybody feel more familiar with the room you're in, because you are the advocate for your care or your family member's care. So make sure you're taking note and you're watching.